Hi viewers, welcome back to Health Simplified. Today's topic is premenstrual syndrome. In this topic, let us discuss what is premenstrual syndrome and how to manage. Premenstrual syndrome is a condition that affects a woman's physical, emotional, and the behavioral health during certain days of the menstrual cycle, which is very commonly just before the menses. It is usually seen during the luteal phase of the menstrual cycle, and the regression of the symptoms occurs during or after the menses has started. The prevalence of premenstrual syndrome: around 10 to 15% are asymptomatic, 50% have mild premenstrual syndrome, around 30% have moderate PMS, and 5 to 10% have severe premenstrual syndrome. Coming to the etiological factors, most of the cases the cause is unknown. There may be a cyclical ovarian activity where the central component as the ovarian trigger, such as ovulation, may initiate a cascade of the event. There can also be a central increased responsiveness to a combination of steroids and E2 or serotonin, progesterone or GABA. In some cases, there are also psychological sensitivity which can cause PMS. The risk factors include a history of mood disorder such as postpartum depression or bipolar disorders, a family history of premenstrual syndrome, a family history of depression, domestic violence, substance abuse, physical trauma, emotional trauma, dysmenorrhea, schizophrenia, and generalized anxiety disorder. The symptoms of premenstrual syndrome include abdominal pain and bloating. Sometimes there can be acne and sore breast present. There can also be food craving, especially for sweets, and some may complain of headache. There is a common complaint of diarrhea, and in some cases there is complaints of constipation also. Some girls complain of sensitivity to light and sound, and some report fatigue during PMS. There are also complaints of behavioral and emotional symptoms which include tension, anxiety, and depressed mood. There can be crying spells and mood swings present during these days. There is also a reporting of irritability and anger in these days. Can experience insomnia and also social withdrawal. Poor concentration and changes in libido is also present during the premenstrual syndrome. With all these symptoms, you can also go in for assessment of other conditions as anemia, endometriosis, thyroid disorders, irritable bowel syndrome, chronic fatigue syndrome, rheumatological disease conditions, and pelvic disorders. You can always have an idea about your premenstrual syndrome with the help of a PMS symptom tracker. The management of premenstrual syndrome can be done by lifestyle modification, dietary changes, complementary therapy, supplements for PMS, medications, and hormone treatment. You must have a little lifestyle modification that can include limited salt intake, eating small and frequent meals, and concentrate on homemade butter and ghee. Try to consume a lot of complex carbohydrate diet such as fruits and vegetables. Try to take lot of calcium and vitamin D foods. Avoid alcohol, caffeine products, and nicotine products in any form. And also try to take lot of multivitamin supplements so that you can prevent PMS. Encourage increasing aerobic exercises, and also yoga helps to decrease the PMS symptoms. Also, you can have an alternative therapy of acupressure and relaxation techniques to calm your body and mind. You can also try with evening primrose oil, which is rich in gamma linolenic acid, which is a precursor of prostaglandin E1. There is a theory explaining that some of the symptoms of the premenstrual syndrome are due to the lack of gamma linolenic acid, and this deficiency can be corrected by using this evening primrose oil. This oil is also found to be very effective for breast pain during this premenstrual syndrome. Next comes the ginger, which lowers the level of pain and menstrual cramps present during PMS. Try to avoid ginger tea in cases of peptic ulcer and other blood disorders. Raspberry tea leaves are considered to relieve menstrual cramps by making the uterus feel more relaxed. Agnis cactus is found to relieve premenstrual syndrome and other menstrual problems. Also, try to avoid vegetable oils and consume lot of coconut oil, which is found to be very effective against premenstrual syndrome done by a recent researcher. Encourage calcium supplements. Consuming 1100 mg of dietary supplement of calcium can decrease the premenstrual syndrome. Your physician may also tell you to take adequate magnesium supplements, and banana is found to be the highest source of magnesium. Taking 400 mg of supplemental dietary intake can reduce the premenstrual syndrome. Daily intake of 50 to 100 mg of B6 can correct many emotional and behavioral disorders, as pyridoxine is a coenzyme in the final step of biosynthesis of serotonin, which is a neurotransmitter to help your mood stabilization. A dietary intake of 400 international units of vitamin E reduces the production of prostaglandin, which is a major contributing factor for PMS and the abdominal cramps. Folic acid supplementation. A daily intake of 400 mcg of folic acid may reduce fatigue, irritability, headache and depression, which are due to the deficiency of folic acid. If PMS is severe, try to differentiate it between the premenstrual dysphoric disorder, which is a health problem that is similar to premenstrual syndrome but is more serious. PMDD causes severe irritability, depression or anxiety in the week or two before your period starts, which needs medical attention. Your physician may also prescribe antidepressants where selective serotonin reuptake inhibitors as fluoxetine and paroxetine cerotate are first-line agents for treating depression during PMS. Sometimes diuretics are found effective. Spironolactone is given for clients who are unable to reduce their weight with exercises and salt restrictions. Sometimes it may lead to bloating. Physician may also prescribe you an oral contraceptive pill. This may stop ovulation and may stabilize the hormonal swings, which reduces PMS. Serotonin is also supplemented in some cases, which is called as the happy hormone. In some cases, there are non-steroidal anti-inflammatory drugs given, such as brufen. NSAIDs can be used to decrease stomach pain and abdominal cramps. They can also be used to decrease the headache, joint pain, and the muscle pain, but can increase the fluid retention. Aspirin is contraindicated in children below the age of 16 years. Brufen is contraindicated in cases of asthma and peptic ulcers. The next is the finding me time. Try to do whatever you feel like doing and which makes you feel happy. Hope this video was interesting and informative. Thanks for watching and subscribe for more videos.